Welcome back to another episode of The Edge, where we talk about controversial topics among teens. I'm Tess Piscatelli, back with my co-host,
Cole Szymanski. We're here today to discuss the causes of suicide with Pauline Amaismeier. Pauline is a licensed professional counselor and also a registered nurse. She has worked both inpatient and outpatient with children and adults with mental health issues. Each day in our nation, there are an average of over 1,300 attempts. There are over 1,300 attempts by young people in grades 9 through 12. Thank you for joining us today, Pauline.
You're welcome.
So, can you just give us a little more on your background, what your job is and what you do?
Mm-hmm. I started out as a nurse and ended up working in the inpatient psychiatric unit in the hospital. And I really like mental health nursing and ended up having a family and then went back to school and got my master's in counseling. So I have 2 state licenses. I am a registered nurse, but I'm also a licensed professional counselor, and I have a private practice in Waterdam Plaza and with a satellite office in Burgettstown, and the name of my private practice is Counseling and Trauma Services. And myself and the people that work under me specialize in post-traumatic stress disorder. When bad stuff, we deal with all kinds of mental health issues, but we specialize in when bad stuff happens, we can help people to heal. And that's exciting.
So how'd you get involved in this in the first place? What was your motivating factor to get into this sort of field?
Well, I'm a helper, I'm a nurse, but I like helping people. I've been a volunteer for the American Red Cross for probably 23, 24 years now. I'm on their mental health disaster team. And what the mental health disaster team does is if there's the most common disaster in southwestern Pennsylvania are single-family fires. And if there's a fire anywhere, and then Red Cross goes and helps to provide food, shelter, and clothing to the victims of the fire. Well, if there's somebody killed or if somebody is injured, if children are involved, if pets are involved, if somebody's just not handling it very well, or if one of the volunteers or the staff of the Red Cross saw something that bothered them, then they call mental health and I go in and talk with them. And I've been doing that for a long time. And that started my interest in helping people who have experienced bad stuff. I'm also a member of the Disaster Medical Assistance Team of the U.S. government, which makes me a part-time temporary government employee under Health and Human Services. And what that means is the Disaster Medical Assistance Team will go into disaster areas and set up a mobile hospital. So this is a hospital in tents.
Wow.
And I am mental health support for the team and the victims. Don't get deployed very often, but when I do, it's very meaningful. Mm-hmm. And I try to do really good work. But again, you're helping people who are in a difficult time. And that's exciting for me.
Mm-hmm. So within your practice that you have, how many therapists do you have underneath you?
5 therapists.
5?
Yes.
And you all see different patients?
Yes. Some of us see children. I'm not seeing children anymore. I'm just focusing on adults, but I have other people who do see children and teenagers, and we see people who are retired. So the whole gamut, the whole age gamut.
So why would you say this has become such a big problem within the past years? What is the new how has the light been shined on mental health?
Because mental health is getting more common because people are talking about it. Back in the early ages of let's talk about the 1900s. Yeah. It was very embarrassing. It was an insult to the family. If anybody had any kind of mental illness, mm-hmm. they hid them, they put them away in an institution. They got restricted to their room. And so mental health is getting more attention because it's coming out in the open and people are saying, you know what, I have depression. And that's not a bad thing. That the stats actually say that 10% of the population, of the US population at one time or another has depression. And so what you have some choices. You can be an ostrich and put your head in the sand and pretend it doesn't happen and then let it get worse and worse and worse. Or you can say, you know what, I am feeling sad. Maybe I can get some help with this. And when you get help for teenagers, I think that you want to be independent. You want to make healthy choices for yourself. But this is an area you don't know about very much. And this is where you go to people who you trust and say, hey, listen, I am feeling sad. What are some of the symptoms of depression? People may feel, okay, now I'm going to say teenagers because kids can be different. But for a teenager, you may not want to be doing things with your friends. Though if you had a hobby like scrapbooking or sports or something like that, you may not be interested in doing it anymore.
Like big changes?
Yes. Your appetite your appetite can either stop eating or you can overeat. Your sleep, you can either, 90% of the people have trouble sleeping. And usually the trouble sleeping is in 3 spheres. You have difficulty falling asleep, interrupted sleep, and early morning awakening. And 90% of the people have problems with falling asleep, but 10% of the people have difficulty with sleeping too much. So everybody is sort of unique and special unto themselves. There's a feeling of hopelessness and helplessness, and ultimately, there's a, if it gets bad, there can be suicidal thinking. And there's also a little bit, on a suicide scale, a little bit less it's called a passive death wish. And your depression is such that it's pretty bad, but you don't have the energy, or there's religious beliefs, or you believe that you have a purpose, and somebody needs you, but you're not going to hurt yourself overtly. However, the way I assess people for that is I ask them, if you were in a car accident through no fault of your own and accidentally died, would that be okay? Well, other than religious reasons, because if somebody has strong religious beliefs, they say, yeah, that's great, I'm going to be with God, and that's wonderful, and I'm happy for them. But somebody who's depressed is going to say, yeah, that would be fine. That would be okay. I would like that. So that's what I call a passive death wish, and that's a red flag. And so there's symptoms of depression, and I want to really, really stress this. It is absolutely, and I don't say a lot of absolutes, but I'm going to tell you this is an absolute. It is never, never, never normal to be thinking about suicide. Never.
So how can someone get to that point that they are thinking of suicide?
Okay, there's causes. There can be, sometimes it's called a genetic predisposition for depression. And if people have depression in their family, there's a greater chance that they can be depressed.
So it can be like passed down.
Yeah, and it's not through anything, it's just genes. And so they just tend to get sad. So if you look at family history, if there's a family history of depression, if there's a family history of suicide, if somebody in their family has killed themselves, that's a major red flag for that person. If there's a common thing about feeling suicidal, and that's feeling hopeless. and not feeling like you're understood at home or by other friends. Now, another thing that's really big is bullying.
Yeah.
And people who are bullied overall aren't able to defend themselves.
Yeah.
If I hold a knife to you, Cole, and I'm giving you a physical threat, so you can either run or fight, okay?
Yeah.
And you should do that. Now, some bullying can be physical threats, but the majority of it is not. And so what do if somebody gives you that sarcastic, oh, I was just teasing, but it hurts inside.
Especially in high school. It happens
Yes.
a lot.
Yeah,
Yes.
whenever you're still like developing and like you're not like a kid anymore, but you're not an adult, so you're just starting to learn who you are, and then people just tear you down and it doesn't feel well.
And so what you're talking about is a difference in power and control. And the person who is being bullied loses their power. And they lose their control. One of the things in counseling that I do is we work on assertiveness skills. And we talk about who is the bully, because usually the bully doesn't have a very good self-image and they're trying to build themselves up by beating up on other people verbally, if that makes any sense.
Yeah.
So, but bullying can really make people feel helpless and hopeless.
Yeah.
And so that it can be a cause for suicide. Any other questions on that?
So would you say it's like one of the leading causes of it?
It's a big one.
Okay.
It's a big one.
Within high school students, it's the biggest. Yeah.
Now let me tell you the second biggest.
Okay.
And I just attended a conference on this yesterday, and this is where I got the statistics. If teenagers are having difficulty with gender identity issues, they've done stats, and when they look at teenage suicides, 30% of the teenagers who kill themselves are having gender identity issues. That's pretty high.
Yeah, that's really high.
Yeah. And so I think that just being aware of that, and again, we're talking about feeling safe in the environment. And people who have gender identity issues are, am I gay? Am I lesbian? And do I want to be trans? Am I, even though I am a female, do I feel like I'm a male? I mean, there's all these questions, and feeling like you're just not fitting in. So that can be really, really, really stressful.
Yeah. And we're actually going to take a break now, and we'll be back after a short break to continue our discussion about this tragic topic.
My grandfather served in World War II. Spending time with him were the best memories of my life. I became a physician at VA because of my grandfather, so I can help others like him. I can't imagine working with better doctors or a more dedicated staff. I'm fulfilling my life's mission with the help of my team and thanks to these veterans. I'm proud to be a doctor at VA and proud to honor my grandfather every day. Search VA Careers to find out more.
Welcome back to The Edge. Continuing our conversation with Pauline, who is a licensed professional counselor. So, continuing with the gender identity role, why do you think that so many people, like you said before, 30% of people that are struggling with gender identity issues have been committing suicide a lot recently?
A lot of them are bullied. And also that feeling of aloneness, of not having anybody who really understands. I think that people are coming out or at an earlier age, and think about when you're a teenager. When you're a teenager, you want to be like your friends. You want to fit in. You want to wear the similar brand clothes and just be with your friends. And when you have gender, for the guys and gals that are just questioning who they are, or they might know who they are and have just been cloaking it under normalcy. They just don't feel like they fit in.
Yeah, they're not accepted within the school.
Yeah, and there's discrimination.
Yeah. And so what are some things that they can do? Like, who can they turn to during this time if they are being bullied?
Well, this is not only for the kids that are having gender identity issues, but this is for all teenagers who are feeling depressed. Okay, because the depression is there, whether the cause is gender identity issue, whether the cause is genetic predisposition. Oh, there's also, if you have like abuse, physical abuse, emotional abuse, sexual abuse.
A recent past tragedy recently happened.
It can be recent or it can be way early. And I can tell you a little bit about that later if you want. But regardless of the cause, you've got depression. And when it's a safety issue, when you're really thinking about hurting yourself, red flag, red flag, red flag. We don't want that to do that. So this is what I recommend. For teenagers to find adults who they trust.
Or even friends who they trust.
Okay, yes, but, okay, I've had so many teenagers who said, well, I was thinking about hurting myself, so I told my friend. Does their friend know what to do? No. But it helps. I mean, and I'm not telling you not to do that, but your friend is not going to be able to stop you from hurting yourself. Probably not, because what you're going to say is, Tess, I have something, or I'm going to tell you, Tess, I have something to tell you. Do you promise you won't tell anybody?
Yeah.
And then what do? You're stuck because the friend is between a rock and a hard place because you told them, oh, I'm thinking about hurting myself. But you're obligated to secrecy. That's why I say, I mean, you can tell your friends, but you need to tell somebody who can assist. Somebody, in this case, somebody who's a little older and has the knowledge of how to help. Or if they don't know, they can find out.
So you say you would tell your parent, and then do parents of teenagers normally come to you about their kids to seek treatment?
They do. Now, a lot of times, the majority of parents do a wonderful job, but some parents, through no fault of their own, blow it. Okay, I'm not telling you anything you don't know.
How do they blow it?
They say, oh, that's okay, honey, you'll be fine.
Oh,
so they just kind of push it underneath the rug. And
and part of it is they don't know what to do. So if that happens, you find another person. Think about your family. Is there anybody in your family who you trust? Think about school. Think about your favorite teacher, the guidance counselor, the principals. I'm going to tell you that people don't become teachers if they don't like kids.
That's true.
So none of your teachers want to see any of you hurt yourself. So they are going to be good resources, and they've had training. I know that the guidance counselor, they can usually call crisis counselors in to the high school if you need to. They have a standard operating procedure of what to do if somebody is having suicidal thinking. The school has their act together. Use them. Use the resources here. Also, there's coaches. There's sponsors. There's my best friend's mom has her act together. Do you see what I mean? Don't keep it to yourself.
Yeah.
Just tell someone that you trust.
But you have to trust them. And if
Yeah.
it doesn't work for them, then you find somebody else to trust. There's also the crisis number for Washington County. I gave it to you.
Yeah.
They will answer the phone 24 hours a day, 7 days a week. And they're really good on stuff like this.
What do they like? Say I would call them, what would happen?
Well, they would talk to you. They would want to know your name and your phone number and where you are right now, okay? And then they'll listen. If they think that it's necessary, they can send a person out to where you are and talk with you. Now, if they think that you're in imminent danger, they will call 911. And also, if you think you can't control it and you're going to hurt yourself, call 911. The police will come. Guess what? The police will not bring you to jail.
Yeah.
They will bring you to the hospital. They will make sure that you go to the hospital where you can get help, because safety is number 1 priority. And we, as adults, all want teenagers and kids to be safe. That's so important.
Yeah. So say we go to like counseling with you or one of your colleagues. Is it like one-on-one with just like the teen, or is it like the parents are in the room? How does that work?
Good question. Well, first of all, the state of Pennsylvania says that any teenager 14 or older does not need parents' permission to get counseling. Okay, now parents will find out because they'll probably see the insurance bill.
So you can like go and get it, and then they'll just see it on the bill. They won't like actually.
Yeah. Now you'll need to have access to an insurance card or work something out.
Yeah.
But that anybody who's 14 of age or older does not need parents' permission to get counseling. Now, ideally, it's better to include parents. And usually the first time for the initial intake, we have the teenager and the family member.
So it doesn't continue like that.
Afterwards, if I give any information from that teenager to the family member, I have to have a written release of information from the student, from the teenager, because what you tell me is confidential. Now, let me define confidentiality. Confidentiality means that everything that's said in my office is secret, but there are there's 2 exceptions. Number 1, if I'm seeing you, Cole, and you say, well, I've been thinking about hurting myself, I will not keep that secret, because your safety is in jeopardy, and that's priority. So suicidal thinking, or homicidal thinking for that matter, because I've had that too, not with teenagers, but with adults. I'm just so mad at that person, I'm going to kill them. Then I will not keep that secret, because that's a safety issue. The second thing is, if I hear about children being hurt, and this is children up through age 18, so I'm saying children, but it's kids and teens. That if I hear them, I am a mandated reporter according to the state of Pennsylvania.
Like teachers.
Yes, teachers, ministers, they've really expanded the list. Anybody who works with people under the age of 18 are mandated reporters. So I have to childline it, which I have done before. So other than those 2 things, everything that a teenager would tell me in session would be secret. Now, I can say, well, your mom is calling me and she wants to know what's going on. Do you want me to say anything, or what do you want me to tell you? Because if without your permission, I can't say anything. Does that give you a flavor for what's going on with that?
In a session with a therapist,
Yeah, and at every session with every client, I assess for safety.
And how often do these sessions happen? Does it depend on like how often do they happen, I should say? Does it like vary depending on the person? Yeah, there we go. I couldn't think of the word.
It does. I've got one person right now who I'm seeing twice a week, because we've got the suicidal thinking down to a passive death wish. most of the time, but there is still some suicidal thinking there. So if there's safety issues, I'm going to see them 2 or 3. I had one person who was an incest victim, and I saw her 3 times a week until she got stabilized. And so it all depends on the needs of the patient.
And
that
then
makes any sense.
do they assess themselves before when they need to like stop having?
Well, we usually
Or
try to
after.
determine that together. Also, when you see people getting better, like, okay, how is your depression today? Well, it's not that bad. Let me see. I was able to go horseback riding when I hadn't been riding for a couple months. When you see the quality of their life improving, then that means that depression is going down. When they say, I'm not having thoughts of hurting myself anymore, when I don't have a passive death wish, when I'm being more active, my grades are going up, because that's another symptom. You know, you don't have the concentration, you don't have the ability to think. You're just not focusing. You know, so when you see improvements in the quality of their daily lives, then that means you back off, you know. And then what'll happen when I see somebody, usually it's once a week unless I think that they need extra help. And then as they improve, I'm going to back it off. Let's go to every other week. And then we can either stop it, or if you're not comfortable, I've got one person who's coming to see me once every 2 months because he just doesn't want to let go. He just wants to touch base a little bit. So, but whatever's needed. You know?
Well, thank you for coming. This has been great. We've learned so much.
It's been fantastic. I'd like to thank you again, Pauline, for helping us better understand the causes of suicide. Remember, you are not alone. You have teachers, counselors, friends, family to help you through this time. No one should ever have to go through this tragedy alone. If you or a loved one has suicidal thoughts, please tell a family member, friend, or call the number 1-800-273-8225. Together, we can help put a stop to this. We can help put a stop to suicide one life at a time.
And that's all for today's episode of The Edge. Join us next time for more topics teens struggle with. Thanks for watching and have a great day.